Okay, present.
For the chief complaint, Aina, a 2-year, 5-month-old Malay girl, was referred from KMC to emergency.
Oh, saya Dato lah. Saya Dato Izzah.
Yes, Dato. We received complaint of bloody loose stool for 3 days duration and fever for 7 days duration. Okay,
Apa?
so for the HOPI,
Semula-semula. Apa cik komplain dia?
bloody loose stool for 3 days and fever for 7 days.
Kenapa you tak buat proper ni? Mana simptom datang dulu? Simptom mana datang dulu?
Fever dulu.
Fever for 7 days, then blood in the stool for 3 days. Okay, start semula.
So Aina, a 2-year, 5-month-old Malay girl, was referred from KMC to emergency.
You jelas tak? You dengar tak cakap dia?
Loose stool for 3 days.
You itu hilang-hilang lah. Saya Dato. Saya Dato. Saya Dato.
Okay. Kejap. Sekejap doktor, saya nak connect dengan saya punya headphone.
You settlekan you punya connection dulu. You dah settle pun tahu.
Okay. Hello? Okay. Okay, so shall I proceed with HOPI? I'm sorry, doctor. Okay. So for the HOPI, she was apparently well until 1 week prior to admission when her mother started to notice that she developed fever, and it is intermittent in nature and worsened at night but resolved by morning. The highest temperature that is recorded at home by the mother is 37.8 degrees Celsius, and it is not associated with chills or rigor or any fitting episode. The mother did not bring her to clinic or give her any medication because she claimed that the fever was mild. On the same day as the onset of the fever, she started to develop loose stool in the afternoon, in which the loose stool is characterized as having watery mixed with some semi-solid stool and mucus. The color range from light brown to yellowish, with amount for about half a cup on the first occasion, but somehow it reduced on the next episode. The mother also had to change the diapers for about 8 to 10 times per day, in comparison to the usual, which about 3 to 5 times per day. Initially, the frequency of the stool was about 15 times on the first day, but for the next 2 days, it somehow increased to about 20 times per day. The normal bowel habit for this child is 3 times per day with soft and brownish stool. The mother claimed that the diarrhea improved 2 days prior to the admission. On the first the diarrhea improved on 2 days prior to admission. Okay. On the fourth day of illness, the mother started to notice that there are a streak of blood on the diarrhea, and the blood was small in amount, ranging from pinkish to bright red in color. She described it as fresh blood, and it occurred for about 3 to 4 times per day. However, 1 day prior to the admission, the amount of blood somehow raised to moderate, in which this caused the mother to be worried and started to seek for medical attention. And the mother also claimed that the child complained of having abdominal pain, but in this case right up, it doesn't mention regarding the site, character, or the severity of the pain. Upon further questioning, the mother denied having any recent contact with sick people and claimed that other family members are healthy. The child was being sent to a nursery, but the mother claimed that there are no similar cases within the nursery. The mother also claimed that the environment of the house was clean and the food prepared was well cooked and in good hygiene. However, she only used one bottle for the meat preparation and did not boil the bottle. She claimed to take care of the bottle hygiene as she usually immersed the bottle in hot water before being used. The mother claimed they used tap water as water supply and filtered the water first before use for daily requirements. However, there are no history of allergy to animal food or medications. And the mother did not know whether there are any recent dengue fever cases in the neighborhood, but she claimed that there are fogging activities 1 week prior to the admission. The mother also claimed that her neighbor's 1-year-old son also admitted to another hospital with the same complaint of diarrhea. Besides that, the mother also claimed that the daughter had slightly reduced oral intake and looked thirsty as she refused to drink milk but frequently asked for plain water instead. She also noticed that her lips and skin were dry and there were mildly sunken eyes, but they improved with improving diarrhea. She was unsure about the amount of urination due to the loose stool, but claimed that the urine to be more concentrated than usual. However, the mother claimed that she was active throughout the days and did not show any sign of lethargy. She also did not notice any loss of weight in her child. The mother also denied any symptom of anemia, such as rapid bleeding, pale looking, or syncope. She was brought to emergency department of suspect after being referred from KMC due to insufficient bed. That's all for the HOP.
Patient masuk bila?
Patient?
Patient masuk bila? Patient tu masuk bila?
Tarikh ke? Kalau tarikh masuk 25 Mei 2018. Tapi kalau ikut disease kan 7 day of illness. 2018.
Shakira, the question.
I want to ask if the mother noticed any skin rashes on her child?
No, there are no skin rashes.
Nurin Sasha.
I want to ask whether there is any vomiting in the child.
No, the child didn't vomit or no. The child didn't vomit.
Najwa.
Okay, I want to ask, is the mother complain of if there is any history of taking outside food or recent travel?
There are no history of taking outside food or recent travel in this child.
Huda.
I want to ask if the patient has symptoms of URTI such as runny nose, cough, and sore throat.
No. This child doesn't have any symptoms.
Sophia.
I want to ask if the patient cry during urination or having a blood in the urine.
Tak dengar, suara you halus sangat.
Okay. Is the patient is crying during urination or having a bleeding in urine, blood in urine?
No, she doesn't have hematuria.
Afnan.
I want to ask if the patient is introduced with the new formulated milk before the onset of the disease, before the onset of the illness.
No, there are no new introduction of.
Apa soalan apa?
Introduced with new formulated milk.
There's no introduction of new formulated milk.
I want to ask if there is any history of travel to endemic regions, maybe regions.
No.
Endemic.
No, she didn't travel anywhere.
Shakira, any question? Any open up? Any questions?
I want to ask if the patient has a habit of picking up small things and then put in her mouth.
The mother mentioned that the child doesn't have any habit of putting small things into their mouth.
I want to ask, is the mother notice any ear discharge from the patient?
No, there are no ear discharge in this patient.
Any other questions?
Any bleeding tendencies such as bruises or gum bleeding?
No, she doesn't have any bleeding tendency.
I want to ask regarding her immunization history.
This child is immunized according to the Ministry of Health vaccination program, but it didn't mention whether the child has been vaccinated with rotavirus or not, since rotavirus might be one of the causes.
Any other questions?
Any similar symptom experienced by the household? Similar symptom.
No, there are no any similar symptoms in the household, only the child.
I want to ask about the past drug history. Is the patient is taking any medication such as antibiotics or the laxative that can cause the diarrhea?
I'm sorry.
I want to ask regarding the past drug history, if the child took any medication such as antibiotics or laxative that can give the diarrhea.
I know this child doesn't take any drug before.
I want to ask, does the child have any increased flatus frequency, which might suggest of malabsorption?
No, this child, no. There's no in this.
Shakira, how bad the fever is?
Mild fever because the
Mild
temperature.
fever. 7 days fever, you think it's still mild? 7 days. 7 days fever kan?
Yes, 7 days.
Berapa umur dia tadi budak eh?
2 tahun 5
2
bulan.
years, 5 months.
2 years 5 months, 1 week fever. You kalau jadi mak, you rasa macam mana? 1 week fever.
Fever dia intermittent. Dia not
Ya,
persistent.
intermittent, tapi intermittent untuk everyday ada fever lah kan?
They worsen at night.
Yalah. So kira what you think? The child is having 1 week fever, you're not worried? You still consider it mild. Why you think it's mild?
Maybe because the temperature
Mana ada
is
maybe?
the temperature is
For your assessment, why you think it's mild? When the child having 1 week fever.
because the fever does not disrupt the patient's activity,
That's all lagi.
and then it is low grade fever because the highest temperature is 37.8 degrees Celsius.
When was that read?
Based on the HOBI is at home.
At home. When was that? Day 1, day 2, day 3, day 4, day 7?
Maybe through about 11 days. I don't know.
Day 1, day 2.
I don't know.
In the HOP, it didn't mention the exact date of the highest temperature recorded.
No. The record, the child was taken during the fever is down, or the child was taken the fever is high.
Mm.
It's the intermittent.
If on the during the physical examination, somehow the fever had
No, there is 7 days already. I'm talking about history.
I'm not really sure
Highest
when
temperature
he had
is out of 7 days. You got once only taken. Once only.
yeah, there's only one.
Then how you know that on the day, betul 3 to 4 days before admission, 1 day before admission, fever is higher than the first one. Is it enough to tell me? Is it enough to tell to just to look into the temperature level? What else indicator? What the other indicator to help you that the child is the fever is not too high?
Maybe because her mother did claim that
Oh,
the
dah
fever
Sakidah dahulu, not you.
Maybe because the fever is
Sakidah,
not
what do you think?
associated with and
No lah, dia ask you, saya itu ask Sakidah.
Maybe because it is not associated with chills and rigor.
2 years old Regos, boleh ke 2 years old 2 years old chills? Boleh ke? You think 2 years old bercakap ke dia ada chills?
No. So the medication, maybe the medication to relieve, if the mother has used any medication or anything to relieve the fever, but from the HOPI, the mother did not give her any medication. So and yeah, so maybe because
I tak faham. I didn't understand. Apa what you try to say?
so for the fever to because it is mild, maybe it is mild because the highest temperature,
Maybe it's mild. I think it's mild because
I think it is mild because the fever does not interrupt the patient's activity. Also, the highest temperature recorded by the mother is 37.8 degrees Celsius. And also due to the fever, the mother did not give any medication to relieve the fever because I think the mother claimed that the fever was mild. So he does not give any medication.
because the mother not concerned, didn't concern at all. Then why it become chief complaint then? Chief complaint mean that the mother are concerned about it. If the mother didn't concern about it, why it become chief complaint?
I'm not sure. Yes.
Not sure what.
Why?
So it shouldn't be a chief complaint, it should be a chief complaint. You say the mother is concern of it. Why we can't chief complaint?
I believe it should not be in chief complaint.
Saya dah told it shouldn't be in chief complaint. Because the mother didn't bother about it.
Because the main thing because the main concern is when there is moderate amount of blood in the loose stool. So that's why the mother go to the for the treatment. So I think it is.
So is it the fever should be in the chief complaint? So the chief complaint is blood in the stool only. Saya Dato, you are the one who present.
I think the fever maybe should not be the chief complaint.
Tak dengar.
I think the fever should not be one of the chief complaints. Since the thing that caused mother to worry is due to the bloody diarrhea.
What you see there are many patients who have fever and who have fever moderate pun we don't put in chief complaint because the mother not that concerned, not lima. But how you know the fever is significant, not significant? Nurin?
Maybe how to know the fever is significant or not significant. When the patient is not responsive to social cues, for example, and then the patient is obviously appearing unwell to healthcare professional, for example, and then if we want to talk to the patient is not cannot stay awake or cannot stay aroused, and then the patient continually cries.
Tak faham, repeat semula atau to find out what you what you want to tell. Can you repeat again?
The fever, how to know whether the fever is significant or not. Maybe we can look whether the patient has any do not respond to social cues, or the patient obviously appearing unwell. And then if we want to,
So in this case,
in this
in this
case,
case,
in this case, in this
I'm talking
case,
about this case.
how to know the fever is significant in this case, doctor?
What you think about the fever?
Oh, okay.
Because your friend
I think about the
you
fever,
think
maybe it is. I think it is moderate fever.
moderate. Why you say moderate? You don't think it's mild?
Because okay, the first one is the fever lasts for more than 5 days, which is 7 days. And then however the recorded temperature is less than 38.5 degrees Celsius, which is indicated mild grade. But then there is no chills or rigors or pallor and other symptoms.
Yeah, betul you kan. 2 years old. 2 years old complain of chills.
Oh, okay. Oh, sorry, doctor. Uh, mm, mm, and it is also moderate because maybe because there is associated symptoms such as diarrhea and then abdominal pain.
Is that indicator fever cause abdominal pain? True or false?
Okay, false.
False.
In this patient.
Najwa.
Maybe I agree that Nurin said maybe I think the fever is moderate.
Maybe you have to decide. Mild, moderate, or severe.
I think the fever is moderate because first the fever lasts more than 5 days. Next, the patient doesn't complain of any lethargy or vomiting or any decrease in fluid intake or any loss of appetite. Plus, the patient is still active, even though
why it can't become mild?
Because the duration and it associated with dysentery.
Fever cause dysentery.
Not fever. fever doesn't cause dysentery, but maybe the etiology cause both of fever and dysentery.
Pardon?
Maybe fever doesn't cause dysentery, but maybe the illnesses that does cause both the patient to have fever as well as dysentery.
So
Infection.
that indicator of dysentery kalau cause fever, it means that fever is severe. So kalau fever due to otitis media, fever due to dysentery, which are more severe fever?
Otitis media.
Otitis media more severe fever than dysentery.
Not really. We need to.
Because apa tu, the causes can decide which is severe, which fever is severe.
No, cannot.
Letih lah. Huda?
Yes, Doctor.
You think what the fever is like? Normal. Your friend cakap moderate. Your friend cakap not supposed to be in the chief complaint. What's your opinion?
My opinion is that the fever shouldn't be in the chief complaint because the HOPI mentioned that the mother referred to the KMC because of the dysentery.
Yeah, but my question is simple. You berapa you putar belik macam tu? My question is the fever. What about the fever? You think mild, moderate, or severe?
The fever might be moderate.
Not mild.
No.
Why?
Because the duration, it is more than 5 days.
Why it shouldn't be severe?
It is not severe because there is no any fitting episode, and then the patient does not complain any lethargy, and then the patient does not have any loss of appetite, and then the patient, the mother said that the patient are still active throughout the days.
No, Sophia. What about the blood in the stool? Mild, moderate, or severe?
The bloody stool. For me, it's severe.
Why severe?
Because prior to that, the patient have diarrhea, and the diarrhea is more than 10 per day, and then the frequency of the bloody stool is 3 to 4 times per day, and then the amount is raised. There's progression. There's progression of the amount.
Increase amount.
Increase amount, yeah.
So the amount to mild, moderate, the amount is a lot, a little, or moderate amount.
It's stated here small, but
small, small amount. How you know small amount?
It just strict the patients that said that it is streak of light. The patient said the mother said that the diarrhea was associated with the streak of light.
Streak light.
Streak of light, yeah.
Then why you say severe? Severe amount, severe.
Because prior to that, the diarrhea is more than 10 times per day.
We're talking about the blood in the stool. We're talking about diarrhea.
All right. So I think it just, I'm going to change my answer. I think it's moderate.
Why you say moderate? Why you say moderate?
Because the first one is because of just the streak of light, and second, it occurred 3 to 4 times per day. Yes. And then the mother doesn't state that the blood is usually for bloody diarrhea, it can goes up more than just streak of light if it's severe.
So why can't it mild? Why
the
can't
patient
mild?
the patient is not anemic. For if it's not severe, like if the patient is not anemic or in shock, and then for mild, because there
it's
is
mild,
progression, because there is progression
of
of the amount. They say that before that it's just a streak of light, but one day prior to admission, the amount is raised to moderate amount of light. But it
amount
doesn't
is
state
raised.
Yeah.
What you mean raised? Become what? Half of the blood, full of the blood, full half of the stool, or is it what tu? Initially was straight only, but now it's what?
It doesn't state it here what extent is the moderate amount, but it said that it raised.
Why you didn't ask?
Yeah, I should have asked.
Describe blood in the stool. Describe lah.
The blood for this patient?
Nah.
Okay.
Blood in the stool, describe it. What was told to you?
Okay. On the 4th day of illness, the diarrhea was associated with a streak of blood. And then the blood was small in amount, ranging from pinkish to bright red in color. So she described it as fresh blood, and it occurred for 3 to 4 times per day. However, one day prior to admission, it was raised to moderate amount of blood mixed with stool on her nappy. And because of this, she was sent for medical attention. Yeah. That's it for the.
What is the sign that you worried about blood in the stool? Afnan, what kind of blood in the stool you worried?
Kalau blood tu more than just a streak of blood.
Itu je. You tahu tak kes yang present case ni, you tahu your colleague going to present this case?
Yes.
You tahu tak?
Tahu.
Tahu, your colleague going to present this case. Blood in the stool. You baca tak malam tadi?
Baca pasal cause of dysentery lah.
Then what is the sign of this blood in the stool that you worry?
Sign.
Mesti ada benda-benda yang sign the stool that you worry. What
kalau dia
indicator that to tell you that the blood in the stool is dangerous?
False smelling.
Tu je. False smelling. Habis, you know, sir, what's the indicator that tell you that the blood in the stool is dangerous?
Sign of anemia.
I have not seen any patient who got blood in the stool anemic. In children, tak jumpa lagi. Tak baca pun tadi, ganti punya. Datang melopong, tak prepare. Kesukaan orang Melayu macam tu lah, melopong.
Kalau color of the stool for upper GI dengan lower GI dia berbeza.
Okay. Apa beza
Kalau
dia?
lower GI dia more to fresh, kelihatan fresh blood. Kalau upper GI ni dia macam
Okay.
darah dah lama.
But where is the warning sign about the blood in the stool? Tell you something, warn you the name. Say Dato.
I guess sign in the stool that cause
You baca tak malam tadi? Blood in the stool.
baca.
Huh?
Baca.
Baca. So what is the kind of stool that give you warning? Tell you the warning.
Maybe if the blood is too much, and then it will.
Bendanya cuma tak baca dah tu. Dia tahu kalau you buka mana buku blood in the stool in children, dia ada kasih warning what is the sign of the stool, the indicator that the stool is dangerous. You buka sekarang buat apa Izzah? You suruh buka malam tadi. Afnan, how many percent
Yes.
if the patient do the patient dehydrated or not?
From HOPI, the mother said that the child having slight reduced oral intake and look thirsty.
You dengar, you listen. Afnan, you listen the question. You listen the question properly. You think the patient dehydrated or not? If you think dehydrated,
Yes,
how bad is it?
I think the patient is moderately dehydrated because
Why you
the
think
first sign that I think this patient is moderately dehydrated is the first the mother noticed that the child is having mildly sunken eye and frontal, and also the tips of the mouth look a little bit dry.
Apa?
The lips and the mouth look a little bit dry, and then there is concentrated urine. The mother noticed the child has concentrated urine, and but however there is no lethargy, meaning that the dehydration is not severe.
So saya tu true tak dia punya tu assessment, your friend assessment?
I guess it's true. True. Yeah, the child is moderately dehydrated.
Moderate dehydrated. And memang ada sunken eyes semua.
Yeah. She has sunken eyes.
Okay.
She has sunken eyes.
Shakira, what is the essence of the case?
The essence of the case is 2-year and 5-month-old girl with bloody loose stool for 3 days duration.
Make it shorter.
Dysentery for 3 days duration.
Dysentery pula. Nurin?
A 2 years, 5 months old Malay girl with loose bloody stool.
Loose bloody stool. Itulah. So, where the next thing come to your mind, Nurin?
Next thing come to my mind is the differential diagnosis of bloody stool.
The causes of?
The causes of bloody stool.
Tell me the causes.
It can be due to acute gastroenteritis, and then inflammatory bowel disease. Bloody stool. It can be because of colon cancer, can also have
colon cancer in this age. Wow.
Itu belakang lah tapi that is one of the causes lah. Lagi. Parasitic infection in the colon.
Najwa.
Maybe dengue fever with warning signs.
Blood in the stool.
In critical phase, maybe.
Critical phase, blood in the stool. Fever for 7 days. Dengue dia fever 7 hari ke demam dia?
Maybe food poisoning.
Food poisoning. Anything else?
Parasitic infection.
Such as?
Giardia.
Lagi?
Anal fissure.
Lagi?
Parenteral diarrhea causes by viral infection.
You baca yang mana tadi saya Dato? Tell me the cause. List me the causes, all the causes of blood in the stool for 2 years old.
Peptic disease, NSAID injury.
Okay, you listen balik Listen carefully. You dah baca for 2 years old with blood in the stool. Remember 2 years old.
And the esophageal varices.
2 years old.
2 years old.
Dan kata dah nak cakap stupid dah tau. Jangan terlepas cakap nanti kang. 2 years old. Esophageal varices. Hello? Ya. Ya. This one is internal hospital for staff. This one is SMS staff. Okay. Please lah, saya tu. Esophageal varices for 2 years old ke?
I'm sorry, Doctor, but in the essential pediatrics, it wrote.
List balik semula.
I read from Nelson Essential Pediatrics. So I also not sure.
Yeah, tapi you don't give one. Kalau ikut macam kawan cakap AGE, betul juga. Can you give the list yang you see? If you tell me esophageal varices, you don't tell me AGE, I'm going to fail you. If you don't tell me esophageal varices, I'm not going to fail you. You don't tell me esophageal varices, I'm not going to fail you. Because I don't expect you to tell me for 2 years old girl with esophageal varices. I don't expect you to tell me. But if you don't tell me AGE, you're going to fail. You see, you baca Nelson, kadang-kadang you baca semua, you tak tahu yang, that's why you have a problem. You nak tahu semua benda. That's why you suffer. For your level, we just want you to tell us the common and dangerous things saja. Bukan you harus hafal semua the causes. So the first thing come to your mind, your voice is something yang common, yang you selalu tengok, yang ni semua, bukan yang keluar benda yang uncommon macam ni. Of course semua orang surprise lah. Osteoporosis. You tahu tak, I tak dah jumpa 26 years old, 26 sampai 80s, for 2 years old, osteoporosis. Tapi AGE lambat-lambat I jumpa. So now you list again causes of blood in the stool in 2 years old child. Dalam exam you tell is common. Apa? You tell me.
Anal fissure. Anal fissure, peptic ulcer disease. Colitis.
Oh my god, memang tak ada, you tak ada clue lalu lah. Lagi?
IBD.
IBD in ini. My god. Lagi?
Ulcerative colitis.
In 2 years old. Lagi?
Juvenile polyp.
Lagi? Mampulah you.
Hemorrhoid.
I think you all memang suffer lah. Lagi? You tak tahu mana yang common, mana not common. Syakira, Google. Bloody stool causes children. Syakira. Google.
Wait.
That's why I told you the student previously, you tahu. I tak pernah buka Nelson when I was undergraduate. Betul, here I am. I tak pernah buka Nelson during undergraduate. Because for me, Nelson very complicated for the student. Dia jadikan student tu tak pandai. Because dia can go through all the possible causes and then you nampak banyak yang kena hafal. Apa? Sekira.
The most common one is acute gastroenteritis.
Kenapa tak boleh sebut? Lagi?
That can be caused by
AGE lagi?
AGE, and then
apa lagi cause?
IBD.
Lagi?
And then polyp. Anal fissure. Interception.
Lagi?
Peptic ulcer or gastritis.
Lagi?
Trauma, prolapse, secondary to emesis, Mallory-Weiss syndrome, and Meckel's diverticulum.
Lagi?
The less common malrotation and valvulus, mucosal prolapse syndrome, Hinosh pellipopera, vasculitis.
During you Google tempat lain, tengok the causes. Nurin Sasha.
Doktor.
Google tempat lain, tengok apa the causes they mention. Boleh Google?
Sekejap doktor, saya tengah Google.
Tengok ada tempat lain yang beritahu cause of blood in the stool.
Senyap tu. Sekejap doktor.
Sound siapa senyap? Orang bising kat belakang tu.
Tak ada.
Ada? Jumpa?
Saya jumpa dekat up to date.
Apa tulis?
Dia tulis kat sini mula-mula sekali anal fissure.
Apa lagi?
Lepas tu milk or soy protein intolerance.
Lagi.
Lepas tu kalau less common cause inflammatory bowel disease. Lepas tu infectious diarrhea. And then juvenile polyps.
Tapi dia ni you kena specify lah. You know, I can give better tau. Effect.
Okay.
Dia dalam dia, you tahu, you see, I don't know. I can give better lagi pada what they can tell you. Apa lagi
Salmonella, shigellosis.
Lagi?
Entamoeba-biasis. Lepas tu Vibrio cholera.
Okay, apa lagi yang can cause blood in the stool?
Can cause apa doktor?
Blood in the stool.
Can cause blood in the stool. Meckel's diverticulum.
Okay.
Anal fissure. Anal fissure dah sebut tadi. Intussusception. Peptic ulcer or gastritis. And then swallowed epistaxis. Lepas tu
Saya dah tahu. Is it possible your case interception?
Probably not because the patient doesn't complain of severe abdominal pain.
Pardon? Complain of?
Severe abdominal pain. He stated that there are abdominal pain but doesn't mention regarding the severity.
Is it enough abdominal pain only? What other thing you want to look at to tell you that this is probably not interception? Other than abdominal pain apa?
Maybe constipation or inconsistency.
You tak baca lah malam tadi.
Constipation is diarrhea.
You study tak malam tadi? You baca tak interception tu? Najwa, buka interception. Google kan dulu. Tell me how the stool interception.
Kalau interception, stools mixed with mucus.
Ada mucus kat dalam stool.
Lagi?
Color.
How they describe the stool?
Current jelly stool.
Current jelly stool. Color apa? Macam strawberry color.
Dia tak mention color di sini.
Yalah, mesti color apa? You expect warna apa? Kuning. Kadang kita panggil strawberry current jelly stool. Because that is the stool that if you had it, you nampak the patient going to have it, you going to be emergency. Faham? Berapa lama you baca tadi semalam tadi saya Dato? Tell me about the apa tu AGE. Itu ni tell me about how what you call it is it possible your case is cosmic protein allergy?
Cosmic protein allergy. I think it probably not because the patient doesn't have any allergic to food or milk.
Itu je. What is the sign patient cosmic allergy? Possible fissure or not?
Possible fissure due to milk allergy.
Is it possible the child is having fissure in the anal fissure result in blood in the stool?
Probably not because the patient doesn't have any anal excoriation. The patient doesn't have anal excoriation, and there is no history of platters that may suggest
fissure
that
versus
this
anal
patient
excoriation. How the stool in anal fissure?
stool in anal fissure. I think it should be constipation because usually anal fissure
How the
also due
stool
to
in
splenic.
anal fissure?
Probably it is hard stool.
Huda, buka anal fissure. How the blood in the stool?
Dia ada blood, streak of blood.
Bentuk dia ialah apa?
Heart pieces.
Ya, tapi how the stool, blood on the stool tu macam mana?
Dia macam tumpuk-tumpuk.
Di dalam ke atau on top of the stool? Surface of the stool?
Dekat surface of the stool.
On the surface of the stool, fresh blood, streak, tumpuk or streak. That's how the probability of the fissure. And usually they don't come with diarrhea. It's more of the ni. So you study the case tak mana tadi? Study. What about is it possible the child got EPEX, enterocoli pathogenic, or dysentery? Kata dysentery. Is it possible the child having dysentery itself?
I think the child do have dysentery because it is associated. I think that it is dysentery it is diarrhea that is associated with blood.
You know dysentery is what?
Dysentery is bloody diarrhea.
Dysentery bloody diarrhea? Sophia, buka dysentery. Apa tu dysentery?
According to WHO, dysentery is a diarrheal episode in which the stool contains visible red blood.
Due to?
It doesn't mention due to what, but probably it can be due to infectious causes, such as E. coli, or parasitic causes such as Giardia.
the main cause of dysentery?
I'm sorry, doctor. The cause of dysentery. For this child, the cause probably due to bacterial origin. Since they are present, the cause probably bacterial origin. Since it is associated with bloody stool, because usually for viral infection,
what the most cause of dysentery?
The common cause of dysentery for bacteria usually Campylobacter jejuni. Campylobacter. Yes.
Tak saja. Dysentery is intestinal inflammation primarily due on the colon. It lead to mild to severe stomach cramps and severe diarrhea with mucus or blood in the feces. Without adequate hydration, it can be fatal. Infection with Shigella bacillus or bacteria is the most common cause. That's why dulu kita orang dysentery means shigellosis. The cause of dysentery usually bacteria Shigella, in which case it's known as shigellosis, or amoeba Entomoeba histolytica. Other causes may include certain chemicals, parasite, protozoa, parasitic infection. Saya baca sekejap dapat tahu dah. First page keluar dari Google. Dysentery, Shigella dysentery. Dulu panggil shigellosis. So any questions? Ada tak mention pasal esophageal cirrhosis anywhere you jumpa tempat lain kecuali the Nelson saja? Betul tak? Saya Dato. Kan I told you already. If you tell me esophageal cirrhosis, you don't tell me AGE, you're going to fail. If you tell me AGE, bawah tu will tell me esophageal cirrhosis, you're going to pass. You tell me AGE only pun, you're going to pass. You understand that? Esophageal cirrhosis won't increase your mark, won't decrease your mark, but it can fail you. Because we want you to mention to us acute gastroenteritis secondary to shigellosis ke dysentery atau dysentery. You can diagnose a dysentery. It's okay. Dysentery, secondary shigellosis ke EH ke EPEX ke Campylobacter, doesn't matter lah. Then the rest, CMA, interceptions, all those things are. But once you mention esophageal cirrhosis as your first diagnosis causes, you fail. Senang kan nak ingat kan, first 1, 2, 3 kan. You tak ingat esophageal cirrhosis pun tak apa. But you talking about adult, different, faham? Adult, you have to mention. You can be penalized if you not mention. Pediatric tak payah. You tak mention pun save you. In this case, is it possible you want to put IBD? Why is it you cannot put IBD in this case? Kenapa saya Dato?
Because abdominal pain is not one of the chief complaints.
IBD itu apa? IBD apa? You tak baca lah malam tadi. You baca ke tak baca malam tadi? Bohong cikgu tu.
Inflammatory bowel disease.
Kalau you baca malam tadi, you can tell me why you cannot put IBD in the diagnosis or differential diagnosis. Kalau you baca malam tadi, you baca ke tak baca malam tadi? You tahu tak, bohong cikgu ni tak berkat.
Saya cuma baca general.
You tahu, kalau bohong cikgu tak berkat. Satu benda you kena belajar, nak berkat belajar ni, jangan jadi sekali bohong dengan cikgu. You tahu kenapa you tak boleh pakai IBD? Anybody?
Is it because
umur dia?
Pada?
Umur dia.
Tak dengar?
Umur. Age group.
Oh, bukan umur. Anybody?
Is it because it is a chronic cases, doctor?
IBD is chronic. It doesn't come in the first 3 days. You're talking about chronic diarrhea, then only you can put is a IBD. Acute diarrhea, you cannot put IBD. You baca dalam mana-mana discussion IBD pun, they don't take it as a acute diarrhea. They put it as a chronic diarrhea. You don't diagnose IBD in the first 3 days. So you baca pasal IBD, you buka causes of diarrhea is IBD. You baca pula IBD. IBD is a cause a chronic diarrhea more than 2 weeks with loss of weight and weak abdominal pain. So you see, if you study the case kan, banyak benda you dah belajar tau. You read around the case, you belajar pasal apa tu CMA, you belajar pasal IBD, you belajar pasal dysentery. Habis banyak benda you dah belajar. You belajar apa tu what is interception, why you worry about interception. You belajar the future of stool interception. Rugilah you. Opportunity nak belajar, you tak belajar. You baca nak exam dia. Oh, nak buat MCQ. Tu tak dapat berkat. So you can belajar around your patient. Banyak you boleh baca. You boleh belajar pasal dehydration. What the sign and symptom of dehydration the patient had. You belajar about the fever. What the kind of fever you worried. You can discuss about the fever. Banyak benda you boleh belajar daripada kes ni saja. You look at the case, you think the fever is not something not to worry about. Why? You look the presentation of fever in this case. You baca the presentation of fever, what kind of fever that you worry. This case tak ada. You belajar. Susah nak belajar. Susah. You gantung pada you minat tak minat. Tapi you all ni minat dengan exam, betul tak? You all semua minat dengan exam. Bukan minat dengan patient. Sebut je exam, kejar belajar. Sampai 2-3 pagi belajar. Lepas tu komplain, banyak nak baca. Of course lah. Kalau you nak belajar esophageal varices in 2 years old, matilah. You all going to die lah. I takkan buka, takkan baca esophageal varices in 2 years old. I'm not going to waste my time on that. Tapi you nak baca. Then you suffer lah. Lepas tu you marah pada kita orang. Kenapa banyak sangat nak belajar? Sebab you choose, you nak choose nak belajar pasal esophageal varices. I tak suruh pun you belajar. I suruh you belajar pasal dysentery, pasal CMA. Tak. Simple je. Ada question? Habis? Habis dah? Okay. Okay, habis lah. Okay.
Thank you, Doctor.